Hello, good morning, everyone. Thank you so much for being here with us today. And for those of you who have not met me before, my name is Rita Ashraf, and I run our benefits program here at American Pharmacies. And today we're going to be talking about a transition of our current benefits from our MUA program into a new and very innovative solution that we're very excited about. We are pretty confident that this is going to become something that's going to be a lot bigger than our current MUA program. This is a new solution that's been developed by our partners at Invictus. We know that it's very important for you to be confident and understand what's going on with this transition. So joining me today are our partners from Invictus. We have Reese West, Scott Amos, and Cody Amos, who they're related to each other. And they're going to walk you through the new plan structures, the eligibility process, and the next steps that you're going to need to take to get yourself enrolled into this program. If you have any questions while we're going through the presentation, please go ahead and either post them in the chat, or you can raise your hand using the feature in Teams that's at the top. It's next to the where the mute button and the camera button are. And we'll go ahead and address those questions as they're coming in. But I'm going to turn it over to Reese now to do the introductions and get the presentation started.
Thanks, Rita. I'm going to share my screen. Hopefully you guys will be able to see it. If you could just give me a thumbs up here in a second. I'm going to do this from presentation style too. Cool. Are you good? You got it?
Yes, we can see it.
Okay, everybody. So we're going to talk a little bit about some really fun and exciting stuff. It's your health plan, some changes coming up around the corner, and hopefully to get you a little bit of excited about it. So just a brief agenda. We're going to go through who is Invictus, like why are you seeing us on the call? Myself, Scott Amos, Cody Amos are on the call today. We have other people on our team that are sort of behind the scenes, similar to American Pharmacies. Talk a little bit about our sort of ingrainment into the independent pharmacy space and how we have collaborative partners that sort of surround you all in the independent pharmacy area. We'll talk about some things that are changing, but really, if I had to guess, what you're kind of want to know the most is how's my insurance changing, right? This is something that you offer to your employees. It's very expensive. It's very important. So we're going to get to what the meat and potatoes of the organization is like how we can bring different and alternate employee benefit solutions to the table. And we've got some exciting things to talk about, much more flexibility, a little bit more control at each independent pharmacy level. So at the employer level, which we're very excited about. Then we'll touch on some tools that Cody on our tech team have put together for you all. We have a microsite. We have sort of an online form that you can submit that just automatically lets us know that you're interested. We'll touch base with you and kind of hold your hand and walk you through the entire process. We understand, that marketing for insurance is not necessarily on everybody's bucket list. It can kind of be monotonous. And we also understand how busy you guys are at the bench and running your business. And then we've put together some frequently asked questions. We've gone through those a couple times. You're probably going to have questions throughout this, presentation. So I was talking to Miguel and Rita yesterday. We really do challenge you guys to just go ahead and raise your hands or stop me and ask questions throughout the process, because a lot of times I bet we can answer them ahead when we get to the end. So we've got about 55 minutes, roughly just under an hour budgeted, but we're going to jump into it. First and foremost, my name is Reese. I work with Invictus Group Benefits. Invictus is a comprehensive consulting firm on all sort of insurance and financial services, whether it's individuals. We do a lot of Medicare for Medicare age patients. We'll talk to you a little bit about that. Scott will. And then we also have a group benefits arm that does, consulting for companies who are trying to figure out how to lower their benefits expenses. That's me and my partners right there on the left. You'll see Travis LePage and Scott Amos, respectively. We were founded in 2015, and Scott, maybe you're better poised to tell the story, but I'll run through it. So they were founded in 2015, actually property and casualty agents. So home and auto insurance is what Scott and Travis had done. And they got into Medicare to round out their business and recognized that there were a lot of other agents that needed help learning how to sell Medicare. It was just to help their customers So they started licensing and training those agents about a decade ago, almost 11 years ago now, Scott. And that's when they developed that Medicare field marketing organization. So really licensing and training, and grew from, just themselves to over 1,300, consultants across the country in 47 states today. A lot of those consultants happen to be independent pharmacists, and we're definitely going to cross that bridge at some point in the future. But, they just work in the Medicare space, and then we've evolved from then. That's when we got into group insurance, and my background was in employee benefits. So this is me. Hopefully, obviously, you can tell. I'm a group benefits consultant by trade. I have been for a decade. I've worked with large organizations, small organizations, associations, group purchasing organizations, et cetera. Anything you can think of, public sector, private sector, healthcare, education. My goal was to try and help those CEOs and CFOs lower what they spend every single year on healthcare cost. Things like carving out the drug, right? We're talking about independent pharmacy benefit managers and things like that. So, and then Scott, if you want to give a quick tidbit on yourself, I know you're kind of the man of the hour on the left here, and you and Travis, and then don't forget your wife, or I'll tell her. And on to the next page, we'll talk about Cody and the rest of the admin team.
Right on. Thanks so much, Reese. So my name is Scott Amos from Jefferson City, Missouri, born and raised. It's where I met my beautiful wife there on my right, Mariah Amos. But I started in the group and Medicare space about 17 years ago. As Reese is kind of the expert in the group benefits space, I self-proclaim expert in the Medicare space. I see a lot of names on this call that I've talked to before. About 5 years ago, I met Ben and Matt Coakley with RX Insurance Group, and become friends with about 4,000 stores across the country. So we've drank the Kool-Aid. We're fighting the fight with you. But about 3 years ago, some of our agents down in Arkansas said they wanted to write their own small group, and it's really hard to spread risk across 4 to 5, 10 lives. And that's when Reese and I kind of got together. I've known Reese for several years. He was a hometown boy here, but that's where we've been developing this plan that we're going to talk about today. So
very cool.
A little bit about Mariah. She's not on the call today, but Mariah is recently retired from the state of Missouri. She's had a 30-year career in statistics with the Department of Labor. She's come in to head our operations and commissions department. So
Mariah's more organized than both Scott and I. That's really what we're telling you. So she helps us out a ton. And then also Travis on the call today. He served a long stint in the military, got into the property and casualty world. He's our hype man. He's our door opener. He's sort of our accountability partner, helps keep everything going, and also helps us find new talent. And then we have Jordan Sayers is our dedicated account manager for all the independent pharmacies within the American Pharmacies family, and also your friends. We're kind of dedicating her to this program. Cody, who you'll notice is on the call, he is the one responsible for building out all the websites, the microsites, the presentations. He takes my discombobulated thoughts and puts them to context, to paper, to screen, and makes them look good. And then Mike Sneller is our Medicare expert. So he helps anybody with patients over 65 or 64 that are looking to learn about Medicare. And then our financial gentleman is Eric Kemna, who's the 401k and all things retirement side. And you'll see here in a second that, oops. Oh, Cody made it bleed in like that. I didn't realize that. So we'll talk about some of our partners in a second, but one of the big questions we kept thinking is why are these people even going to want to care or listen to what we have to say? And we're super appreciative for Miguel and Rick and Rita and the entire American Pharmacies team, because we work with independent pharmacies all over the country already. I mean, we're hitched up to over 4,000 of them, whether it's a financial relationship or an insurance relationship or Medicare relationship, you name it. So we try and help pharmacies in any way possible. We try and help them add revenue. We try and help them lower their expenses. It's sort of our niche market. And we do work with other types of employers, but you guys are also one of the best distribution channels in the country. You own your business. You're in a community. You know the other entrepreneurs. You know the schools. You're sponsoring the sports teams. So the whole reason I left my consulting role and joined Invictus was to try and join a grassroots effort to educate people about the big three. And I'm sure some of you are shaking your head about the big three PBMs. I know I do in the morning. It drives me crazy. There's so much fraud, waste, and abuse, and there's so much misinformation. And even like a local employer here to Scott and I, we were working with them. They're a 1,000 life religious organization. They're overspending by, $2 million to Express Scripts. And they just signed their renewal and it's on autopilot. And, congregation members have no idea, staff have no idea. So we just need to do a better job as an industry of educating people. And you guys come with so much credibility, more so than even what we have. We do talk about some of the stability and the transparency. So what you'll find in moving forward is you're going to actually be able to pick and choose what is best for you. It's no longer a one for all for one, and that cannot necessarily mean a bad thing. That's sometimes a good thing, and I'll explain the underwriting story to that in a second. All of our carriers that we're going to recommend, I wouldn't put them in front of you if I wouldn't put them in front of my parents or my siblings. We have pretty high standards when it comes to that. Nothing risky is going to get through sort of our gatekeeping status. The carriers that we are recommending, you see on here, the one you'll see the most common is Triad. And so Triad is, we'll talk about it here in a little bit more detail, but I just want to define it so you know what we're talking about. It's a healthcare provider only health plan. So doctors, dentists, chiropractors, and now pharmacists. We've negotiated with them to add you guys in there. You were always healthcare providers, but now that we're sort of the megaphone, right, arm for pharmacies. And so it doesn't necessarily have to be Triad, but it can be. They're doing very well. It's a healthy pool. Rates are, significantly less. They're more competitive by 20% or so on average than the current MEWA rates that we're seeing, which we're excited about. And their renewals have been stable. They're under 5% since 2020. And that doesn't happen very too often, especially when you look at pooled plans. And at the end of the day, that's really what the MEWA with United Healthcare was. So our partners include, we work as Scott mentioned with the Waypoint Company and the Pharmacy Insurance Group. That's just to tell you, our 401k and services are through the Waypoint. A lot of you guys are going to be familiar with the Coakley's. Ben and Matt, they're great. And then the Pharmacy Insurance Group helps pharmacists set up Medicare agencies so that they can use some duality in their patient mix, right? They can protect their patients on the Medicare side and continue to service them on the prescription side. Just some general overarching changes about the current United Healthcare plan. So it is going away effective December 31st of 2025. It was one carrier option and limited plan designs, which happen to be very regionally appropriate. So if you were in certain markets, for example, Texas, you had access to plans that felt better than in other markets. And it was a global rate. So it was all for one for all. Everybody's at the buffet. You have access to the same thing regardless of whether, you have a food allergy or you're healthy or whatever. So moving forward, we're talking about several plan structures. I'm going to go over that in a second. Really, I want you to just think of 3 buckets, and I'll define those in a minute. Several carriers and networks. So some people maybe didn't have a doctor that was in the United Healthcare network previously. Now they're going to be able to tell us, hey, I really would like to see this doctor in my network. And it's our job to kind of go out and do the bird dog hunting to find you the right plan, the right solution based on your size, your risk, so on and so forth. Tons and tons of plan options here too. So one of the challenges, and maybe it's unsolicited or too much information, but we had 5 to 10% of the people represent a large portion of the cost under the MEWA plan. And what you really want to do is reward the ones that are really, really healthy, but find solutions for the ones that also need help. We're not just throwing those people to the wolves. If you have a high cost claimant, then you probably need more help than the average person. And that's what we've kind of designed this workflow to bring to you all, is a standard solution and a backup plan, and then a backup to the backup plan, for lack of better terms. So this is just imagery. A lot of the times you guys are familiar with, your BUCAs, but that's an acronym we use heavily in our space, right? Blue Cross, United, Cigna, Aetna. We work with all those companies, and Scott, plug your ears. We don't like to, but we have to. It's just a nature of the business that smaller groups sometimes will not forego having that Blue Cross card. If you're here in Missouri and you don't have Blue Cross, or if you're in Alabama and you don't have Blue Cross, you're in Colorado and you don't have Cigna, right? There's certain markets where those carriers have really sort of monopolized and brainwashed consumers, whether it's directly through marketing or even through sometimes brokers. But we work with a ton of carriers. And I just put some logos on here. These are some common solutions that we're seeing, like Triad on here, Angle Health on here. Optimal is a really competitive carrier right now. And so what our job is to go out and find you the best benefits for the best rates. Carriers are, like I mentioned, they're uniquely competitive in certain markets. And it's our job to do the looking. One of the most exciting things, okay, so let's really quickly just talk about our 3 buckets of healthcare solutions, right? Our first one is just this alternative health plan. And you can think of that as like, if you were to call a broker and ask them to market your plan to as many carriers as possible, that's really what we're doing. We have a couple really preferred partners who consistently have given us what we've asked for. And part of that ask or that request has been, we don't really want to support one of the big 3 pharmacy benefit managers. You know, we have all kinds of pharmacy purchasing groups all over the country fighting in Washington and local legislation against and for pharmacy benefit reform. So some of the programs that we put together, you know, they have a TrueScripts, for example. That's the pharmacy benefit manager behind Triad. And you might say, you know, they're leasing the Optum network, but the goal is we're going to have to crawl and walk and run. So we've got a lot of plans and a lot in store for this. These are some of the other independent pass-through pharmacy benefit manager names. Hopefully you guys recognize those, and hopefully they become more common over time. But yes, we don't want to support the people who hurt us the most, if that makes sense. The second bucket of, as I mentioned, of the health plan solution is going to be like an ICHRA plan. So ICHRA stands for Individual Coverage Healthcare Reimbursement Account. What this means is individual plan on group chassis. So pharmacies who, let's say we go through underwriting and we look at the 6 or 8 different health plan, you know, alternative solutions, and maybe they're just too sick, right? Maybe I work for you and I'm an asthmatic and I have to, you know, take a specialty med or whatever. Then they really have historically felt like they can't do anything. They have to pay astronomical rates. And so did the healthy groups in the same pool. Now what we can do is we can look at individual plans on a group basis, and they're called ICHRA plans. They're growing in popularity, but they're essentially off exchange ACA metallic level plans. And you set an allowance for your employees and then say, hey, go to the exchange and just grab whatever plan you want, whatever carrier, whatever deductible, so on and so forth. And we have a lot of pharmacies that are doing that already, but they're not getting the tax benefits, right? They just say, hey, I give them, you know, $400 extra a check, or I give them a quarterly bonus, and they use that money, and you're paying taxes on that. So an ICHRA is a great solution for groups that may have higher risk and can't get something on an underwritten basis that's much more affordable. The last, and I am looking for notes here in the chat too, so I'm trying to follow along here. I haven't seen any questions come in. The last asset class is for individuals and sole proprietors. So if you're a 1 or 2 employee pharmacy owner, or maybe it's you and a spouse and maybe 1 or 2 other employees and they don't need insurance, we can look at underwritten individual products. You'll see the 3 names on here: IHA, Datego Health, and CHAS. These are all companies that work with name brand insurance companies. I know Blue Cross Blue Shield is included in some of those individual options. They also offer what's called reference-based pricing. So if you're familiar with that, they offer those kinds of options. I've personally seen, we had a pharmacist in Louisiana paying $2,600 a month for his family of 4, and his CHAS rate came in because he's relatively healthy. He's not, you know, a smoker. He hasn't had a heart attack or stroke. He doesn't have cancer. He's now paying about $1,600 a month. So it saved him about $12,000 a year on that individual solution. So the story is we're not necessarily sitting here and telling our pharmacy partners, our APRx members, or any pharmacy for that matter, that, hey, you're going to fall into this bucket based on a certain set of criteria. But what we do say is, we think this makes the most sense. Why don't we check 1 or 2 of those options, or all 3 if we absolutely need to? So the whole purpose is for us to be agnostic. You know, I had a mentor of mine tell me that when I first got into the business. Brokers who are bought off by these big insurance companies and that are placing and retaining business with certain carriers, it just creates conflict of interest financially. So our motto here at Invictus is to do the right thing and the money will follow. That's always the best way to treat people. It's the golden rule if you're into scripture at all, but you do the right thing and treat people the way that you want to be treated. Our goal is to objectively find you the best plan at the best price. That's really what we want to do. On paper, you're probably thinking, well, this guy's just another broker. At the end of the day, yes, but we don't like that term. We like to think of ourselves as an extension of any organization that we work with, any one of our clients, right? We're part of the HR team. We're part of the finance and the budget team. You know, we just want to try and help as many people as possible. Independent pharmacy is really important to us. You know, there's several methods, as I've kind of gone over: alternative health plans, ICHRA, and individual. This is going to help you possibly beef up your benefits, right? And we talk about some case studies here in a minute, but I want to understand, or at least illustrate the financing behind why group purchasing plans, and oftentimes this is the story. You guys are not unique in that the plan experienced challenges and that prices rose. In order for a pool to be healthy and to be stable over time, it has to grow. You need to be adding lives to that. And if the pricing is so expensive, especially when you're hiring younger pharmacists or younger talent, there's more affordable ways for them to get insurance, especially if you're not an applicable large employer, which most independent pharmacies are not. So if you have less than 50 total full-time eligible, then you don't legally have to offer benefits. What happens with all MEWAs at some point in time, unless they're managed in a very challenging way, is that you have a very small percent of the population that represents a very large percent of the cost. So when we met with American Pharmacies leadership, we say, hey, unfortunately we have 5% of our people representing over half of the cost. That means 95% of our members are overpaying for benefits. And that's what we're solving for moving forward beyond the new year. So 95% of you guys are paying too much, and it's all on account for the 5 most expensive. Now, the number one most important thing was, some people would come in and say, just kick those 5% off, and tell them to go do something different. That's not cohesive, right? That's not supportive, because in any given day, I could be on that list. Scott could be on that list. Someone from my team could be on that list. Car accident, cancer, that stuff doesn't discriminate. So we could all be a large claimant at some point in time. So we wanted to find sort of de facto strategies to help those people make sure that at any given day, in any given healthcare journey, and any given cost, we've got something that can help American Pharmacies members and prospects, right? This is a way for them to help grow their membership too, because this benefit is available to all pharmacies. So we're excited about it because money. Everybody likes to talk about money. Everybody likes to save money. The goal is to save money without sacrificing the integrity of your benefits. If you're thinking in the back of your head, how many times have you just had to raise deductibles or raise out of pockets or to lower co-insurance, right? We're essentially diluting the benefits plans in order to pad the checkbook. And that's a strategy that worked for a while, but you can only raise deductibles so high before it becomes effectively unusable. So excited about savings. We're excited about the customization. I truly love my job. I nerd out on this stuff. People think I'm crazy, but I love to try and solve problems. I love to look at your pharmacy's demographics, your average age, your location, the healthcare landscape in that market, and to try and put something together that genuinely makes sense for your independent pharmacy. United Healthcare is a big national carrier, right? With the MEWA, they picked a great carrier to do that, but it's getting so expensive now that we kind of have to take a little bit more of an intimate look into this stuff. And you guys have businesses to run. That's not your job. It shouldn't have to be. Unfortunately, for a lot of industries, it is. But that's what we're here to do for you, is to kind of take that off your plate, show you absolutely everything that you have access to and how much it's going to cost, what that change is going to feel like, right, at the consumer level, and then how you can proceed and move forward. And I mentioned earlier, we really want to be an extension of your team. That's how I view it, right? We can be as active or as inactive as you'd like. And then at the very end, you got tons and tons of solutions. So just a general case study, and this is about the Triad plan. I'm going to explain that here in a little bit. So the Triad works with 2 networks. It's MultiPlan and Cigna. That's some of the flexibility there, and TrueScripts. So we kind of build our own healthcare plan with our own vendors. We unbundle it. We tell the insurance carriers, hey, see you later. And we pick our own administration and pharmacy and stop loss and things of that nature. It's still an indemnified insurance premium, which means you pay a fixed premium every month and you're not on the hook for claims or anything above what the premium is. We were seeing somebody pay about $12,000 a month and their premium came in about $8,200. So it's 34.6% off on the premium per year. Now, I don't want to say that's average, but that's kind of what we're seeing, is anywhere between that 20 to 40% range. That's $4,000 extra a month. And we, as I mentioned, I've talked to a lot of our clients, current clients that are pharmacy owners. They're saying we got to sell a lot of scripts to make $4,300. You know what I mean? Or that's the helps give me a raise to a salary to a pharmacist so that I can spend more time away from the bench and go out and look at growing my business or doing other things, right? So it's a lot of money. I mean, it's real money for you all. Real quickly on the timeline. So we're essentially a high performance marketing agency for you guys. We want to make sure that we don't leave a stone unturned. And the end of this year is going to be very, very important, because I was telling Rita and the leadership team yesterday, undoubtedly, we are going to have someone, call us or send us an email on December 15th or December 30th, saying, hey, I'm on the plan, but I didn't get a new insurance. It's just super important that if you're currently enrolled in the MEWA plan, that you get in touch with us as soon as possible, because your health plan will be going away on the new year. So we either want to help you try and find something to replace it, or we at least want to verify that you have plans, even not with if they're not with us, right? We just want to make sure that you and your employees and your families are protected. So we're starting the quoting process now. You guys may have seen the newsletter come out a week or so ago. There's about 25 or so that we're working with, and more are coming in every day. We're trying to upkeep a 24-hour policy, so you should hear from either myself or Jordan or Travis within the first day or two, depending on when you fill out that form. As soon as we have that discussion, what we're really doing is vetting you out a little bit, right? We're doing our research over the phone. We're trying to figure out what bucket you may fall in. And then we're going to be asking for some information. So you're going to get an email, and yes, it's going to have some homework. But again, to save 36% a year, or to mean that you have insurance on January 1st, it's not too much, right? It's a census. It's a little bit of information about your current employees and whoever's enrolled in the plan. It's a little bit of information about your premiums and your contributions. And then we go out and we do the rest, right? We go out and find what else is out there, and that's for you. The most important thing, and quote turnaround times right now are 3 to 7 days. I've seen them same day. I don't like to tell people that, because if they don't get it same day, they get mad at me. As we get closer towards the end of the year, all of these insurance companies are renewing 70 to 80% of their entire blocks of business. So it gets busy, busier than normal. And I always tell people, insurance already moves at a snail mail pace. These people are slow, right? They still operate on fax machines, if that tells you anything. Okay, so the sooner you get this information to us, the sooner we can get those parties engaged, and ultimately the sooner we can get some numbers and some plan designs back for you. That's really where you need to be in order to look at it and make a decision. You're going to point and tell us, and then we're going to go. We're going to help you do open enrollment. We're going to help you get it installed, or help your employer access portal get set up for ads and terms. All of that stuff needs to happen before the 5th of December. So that's our D-Day. The 5th of December is, we need to have everything submitted, regardless of if you're an individual plan, if you're an ICHRA plan, if you're an alternate benefit solution, and if you're with, Triad or Angle Health or Optimal Health, or if you want to be with Blue Cross or Aetna. Our goal is to have all current MEWA members done by the 5th of December. Okay, so one of the cool things too is Cody's built a couple tools and resources for both you, for us, and for American Pharmacies. If we go to the website here, it takes you right to our microsite. So all we had to do is click this little button, and it takes you over here. There's all kinds of information on this page. It talks about how we support independent pharmacies. It tells you a little bit about Invictus, but most relevantly, it has this get a quote button up here. So if you click this, this is going to take you to what we call a JOT form. We use this pretty often in our Medicare contracting industry, right, to collect information. You're going to tell us who you are, where you're located, how we're going to get a hold of you, and whether you're the owner or the benefits manager, etc. And then you're going to answer if you have a current plan in place. For most of you, we already have the American Pharmacies MEWA plan designs. So when you click yes, it's going to ask for your eligible employees, your contribution, your tax ID number. And if you happen to upload your census and have one handy, then that's where you can do that. And it's all HIPAA compliant. You'll see this, this is, it's not cheap, right, Scott? JotForm makes a lot of money on this HIPAA compliant website. So your data, rest assured, and guys, I was raised by, someone who is paranoid. I get it. I don't want my social floating around out there. I don't want my birthday out there. I'm worried about, paranoid about, identity theft. This is all closed and secured. They're not selling anything. That's why they get that HIPAA compliant badge. So I'm going to take a pause real quick before we get into some of the frequently asked questions. Is anybody, or anything I've said thus far, anybody confused? Anybody have general questions? Let's see. Nobody in the chat. I know this is not very fun to get on at 7 in the morning and talk about insurance, but I'll go through a couple of commonly asked questions, and maybe we can debunk some that you all are thinking. I totally get being nervous, but who qualifies for the program. So, you know, independent healthcare providers, independent pharmacies, and APRx members, right? So that's you guys. They have an internal sales team that's reaching out to a lot of their active members that are not enrolled in the MIWA. What do you need to give us for a quote? We've kind of already touched on it. When you fill out that form, we're going to call you and tell you more intimately, but essentially it's a census, your current plans, your current rates, and then some of your demographic information, right? Your name, first and last, date of birth, and then most importantly, your zip code. If you already have a census filled out with more information on it, great. One of the questions we got is there a way I could be completely rejected, right? So you tell me you're going to look at all three of these different options for me. Is there a way that you can tell me, oh, we absolutely can't insure you? Technically, no. We're an individual firm as well, so we work with the ACA marketplace. We've got several individual plans. We are able to place coverage for everybody. Are there contribution requirements? Yes, this is a great question. So with employers who are offering group plans, in order to meet affordability, your lowest wage employee can't pay more than 10% of their income for healthcare. That typically translates to a 50% contribution. So certain carriers, right, Triad being one of them, our plan for independent pharmacies, they require a 50% employer contribution. So just keep that in the back of your mind when you're looking at total budget, total cost. You're responsible for 50% of the employee-only tier. Most of our pharmacies don't contribute towards a spouse or towards dependents. That's how a lot of people do it. Let's see. Okay. Participation requirements, that's going to depend on carrier. So some people say if I have 10 people but only 2 enroll, we have to tackle that on a case-by-case basis. There's no fabricated answer that I can give you. And then what if you're able not to join the Triad program? Everybody's excited about Triad. We are too. We've worked with their leadership. Their pricing is exceptionally competitive. But we do check, and in order to hold them accountable, we'll look at other alternative group plans as well. So if you have 3 or 4 or 5 or 7 or 27 or however many people, we're going to be able to look at Triad, and we're kind of going to use them as a benchmark to compare to what other plans are available in your area. They're so different depending on what state you're in and what zip codes you're in. So some questions around cost. Well, before I do that, let's go back. Any other questions around eligibility and underwriting? Underwriting really is a fancy term for, you know, screening. So we have a process where we're gonna screen groups just with a census if you have 10 or more enrolled. If you have 10 or less enrolled, we're actually going to use this online program called Easy Apps, which is also HIPAA compliant. So if you can set up a Facebook profile, then your employees can log in and complete their Easy Apps. It's very simple. We've got all this sort of structured into, you know, chronology. We're not going to miss any steps. Okay, no questions. Rita, you have a quiet group this morning. That's okay. No questions around eligibility and underwriting. The second thing we had a lot of questions around cost and plan design. What benefits do you offer? A better question is what we don't offer. You know, medical, dental, vision, disability, life insurance, even the Aflac-like lines, right? The Nick Saban commercials, with accident, critical illness, hospital indemnity. We have executive benefits consulting for CEOs, CFOs, and HR directors who have gaps in disability and life insurance, right, and need higher guarantee issue amounts. We have a 401k consultant on staff, and we work with the Waypoint company. So your you know, retirement benefits, financial benefits, all kinds of things like that. We even offer. Oh, go ahead, Scotty.
Hey, Reese, you know, like just to kind of touch on that, you know, and I think this may be a concern that we've been helping several pharmacies with is the short-term disability. You know, I mean, it's hard enough to find a pharmacist in charge, and then all of a sudden people have babies, you know, like my son, and so we get to have grandbabies. But you know, that person may need to be off work for a little while. We may need to have some short-term disability, and so we've got a plan for that too, you know, to be able to help offer that and maybe have some tax savings as well. So,
yep, 100%. So, and there's really the thing about what people don't want you to know about the group broker industry is that if you have your life and health license, you can get contracted with pretty much everybody. So we've had pharmacies say, hey, I work with this carrier, and I'm like, wow, I've never heard of them. You know, I pick up the phone, I call him. Scott is licensed in all 50 states. He gets a contract, and all of a sudden, boom, you know, we're working with those people. So we're evolving too with our groups, and we appreciate that. It helps us grow and become more diverse. What are the plan options? I could spend the entire hour talking about the plan options. Really, you know, kind of the world is your oyster. You can pick a high deductible health plan, right, an HSA. You could do an HMO, a health maintenance organization, which has no out-of-network benefits. You can do a preferred provider option. That's just a standard run-of-the-mill network in and out-of-network benefits. And then we even have, you know, tons and tons of, you know, structures, right? Individuals, ICHRAs, group plans, even the large group plans, right? That where people have maybe 100 employees and they want to be self-funded. Maybe we'll write a direct contract with a local hospital and we'll stick them in a captive. You know, there's so much creativity that you can introduce into this conversation. And as these groups, you know, as we get a hold of them and we gain more traction, the goal is to use our economies of scale with our preferred partners and negotiate better decrements on behalf of all you all. And the fact that you're in the pharmacy space is just that much better because, you know, 80 to 90% of employers, when they sit down with renewal conversations, and this is how it was in my previous role, the first conversation on the agenda is always about prescription drug utilization. And you guys already know why. You know, specialty drugs, mail order issues, it's all the, you know, the vertical integration that happens and the spread pricing and the rebates and the formulary manipulation. There's just so many ways that we can help companies save money. How do rate calculations and renewals work? I love this question. So the difference between what you're doing today and what you're going to do moving forward is that you're no longer paying an average rate. And that's going to be good for people who are better than average. And it's going to be somewhat of a challenge for people who are below average. But what we looked at is that there was so few people below average, and we can find subsidized ways or creative ways to help those people still not pay too much and also have really, really good benefits. So we go through that underwriting process. You get a risk score. Really what they do is they go to this thing called the Medical Information Bureau. They pull your name and all your people off your census, and they're going to tap into what drugs you're taking and what, you know, previous procedures and diagnoses and prognoses you've had in the past. You're going to get a risk score as a control group of 1. So if you're, you know, 0.98, you're preferred. If you're 0.102, then you're unpreferred. And then they're going to apply your rates. And all the carriers do this differently. They have different manuals and different standards. For example, one carrier may have a drug carve out, so they may have more risk in the drug space. Another carrier may have a direct contract with the local, you know, surgery center. So MSK, right? And those kinds of things. They may have a higher appetite for that. That's why it's our job to look, right? We don't know until we take a look. How does it compare to the MIWA? So we are seeing rate reductions about 8 or 9 out of 10 times. That does not mean everybody on here is going to pay 20% less. I can't stress that enough. Okay, for most of you, we hope that that's the case, and that's what we have seen. But really, the underwriting and your census and who you have working for you, et cetera, that's going to dictate that. It's not Scott or I. We're sort of the, you know, the liaison in between that's actually, you know, contacting the right people, letting them know. Higher risk groups, as I mentioned early on, we're going to look at, you know, sort of default strategies that maybe use broader economies of scale on an individual basis. That's really what that ICHRA plan is. The highest group savings we've seen is now up to 52. I needed to update this, but it's 52% savings, which is awesome. It's over half. Last 2 questions about cost and plan design. We got, oh, hey Rita, I got a hand up. What do you got?
I wanted to ask, what is the average size of the groups that you guys have gotten from for the independent pharmacy block?
Yep, it's probably 8 to 12, somewhere in there. And some of them are smaller. We have a couple that are 2s and 3s. We have some that are, you know, 15s and 20s, but I'd say the average is around 7 to 10 or 8 to 12, somewhere in there. Good question.
Okay. Yeah, so what about I know you covered it a little bit, but what about our groups that they might have like 5 full-time employees, and then most of them have coverage through their parents or their spouse. So really it ends up being the owner who may be able to sign up, but they're just not sure if the other employees will sign up.
Yeah, so you can check both, right? If we want to look at all 5 of your full-time employees, I mean, we tell them owners all the time, I'm like, hey, it doesn't hurt to look, see what they're paying now and what their value is, right? What their plan is, what's their deductible and out of pocket plus their premiums. That's their total exposure. And then if we put a group plan together, let's look at what's their deductible and out of pocket and what's their total premiums and see what their exposure would be through the employer. Simultaneously, if we do that exercise and we find out that those employees are better to stay on a spouse's plan or to stay maybe on mom and dad's plan, which is always the cheapest, right? If mom and dad are paying for it, then we can be looking at an individual solution for that single, owner. And they, if they want to offer that same individual plan to maybe one employee or another, then they can do that. The general rule of thumb for a group, what defines a group, is an employer with 2 or more, and you can't be married, right? So no, I call them spouse duo teams. Even if your spouse is on payroll, that's not going to constitute a group in the eyes of insurance companies. So if it's you and a spouse, then we'll look at an individual. If you've got 5 or so full-time people, we're going to check both. We're going to check the group side, and we're going to check the individual side and see what makes sense. Hopefully that answers your question, Rita. Is that good?
Yeah, and I know that a lot of our current members have had that same question, so hopefully that addresses any confusion anybody had. But what Reese is saying is that it just depends on your individual situation, and they'll look at several different options and recommend the best one for your group.
Yeah, I tell people I'm really just a guide. I mean, you guys are driving, it's your company, it's your healthcare. But we treat people like family. We'd tell you what we would recommend. And there's a lot out there. There's tons of options out there. So it's been fun and I'm going to take a second, Rita, and sort of compliment the audience, because I've told both her and Miguel, I've had conversations with a lot of you guys, and it's been awesome. You guys are great people. And I'm used to working with really ticked off chief financial officers who would scream and yell and throw a temper tantrum. And it's just nice to converse with people who are salt of the earth. So reminds me of home. I'm from the Midwest, where manners matter. If we don't have any other questions on cost and plan design, I know these last 2 are important. People ask about ancillary insurance. So most of that is with Guardian today. We've bugged Guardian, and we're evaluating that on a group by group basis. But I don't ever like to just give anything away for free. So we've introduced a couple other carriers to that competition, and we're not going to place all our business with one company. We're going to make them earn it every single time. So if you have a company that you prefer, that you really like, let us know, and we'll add it to the mix, at least for your group, right? This question is a little bit, it's a little bit arbitrary, but it should say, how many plan choices do we have? And that's also indicative of how many employees you're going to have enrolled on the plan. Personally and strategically, the more plans, the more complicated, right? So if you can minimize that plan offering, it makes it easier from a billing perspective, from an administrative perspective. But I also understand that you want to offer something that, like, for example, a lot of our pharmacies are like, hey, I'm an owner. I want to be in a high deductible health plan to save the tax dollars. But my $15 an hour employee, they can't afford a $5,000 deductible. So I need a copay plan for them. That's totally fine. We can do that. As long as you have a couple enrolled, typically it's 2 plans per group based on our average size. If you've got, 50 people, that's a different story. If you're only one person, obviously it's 1 plan, okay? And we had a lot of questions on average premiums. I didn't put those in here, but we're seeing medical premiums. I literally saw a $289 rate the other day, which is insane. I kind of had to, pinch myself and rub my eyes to make sure I wasn't seeing something. And then we've also seen, we've seen rates up to the, $700, just like where they are today. So it really just depends. And then dental and vision and life and disability, all those things, they're very, very standard. That kind of just comes with it, right? Okay, so enrollment and overview. I mentioned already, can't stress enough, December 5th, 12/5 of this year, we want to have everything submitted. That way ID cards are in hand and billing is set up, and you guys feel good and you can enjoy the holidays and not have to stress over, getting your insurance set up. One of the things that's unique about, our strategy moving forward is once people enroll on January 1st, it's not like we have to wait a full calendar year to go through that process again. We can actually help people throughout the entire year. You can join early, you can join late, but for actively insured Me1 members, we want to make sure that you're at least doing something for the first of the year, right?
And I want to just reiterate that timeline. December 5 is the date that all enrollments need to be in. And so we're recommending that you have already made contact with Reese and his team and submitted your census, any questionnaires that your employees need to submit, everything like that needs to be sent in by November 10. And then that way you can give your employees a week or two to go through the plan options that are available for them, have them make their decisions and enroll into the plan that fits their needs the best. And so by December 5, all your employees would have sent in their enrollments. And then you don't have to worry about anything. Reese and his team will take care of everything else, and you'll get your insurance cards in the mail well before January 1.
Yep, 100%. Yeah, it's always better to start early than late. I can hear my high school algebra teacher telling me the same thing, don't procrastinate. This question here, what if my renewal isn't January 1st? We had this, so after the fact in January, say, you may, if you're on the plan, it's not really for you, but if you're an American Pharmacies member that hasn't been on the MIWA, you may be on another plan that renews in June, and you're curious, hey, can I get on this in January? Most of the time, yes. I say that because not always. There's a couple different financing mechanisms, whether you're on a monthly contract or an annual contract. All it takes is for me to read where you're currently at, and I can tell you, yes, you can leave early if you're fully insured, you're month to month. You can mark it and look at it for January 1st if you want to try and save some money. Case in point, though, is that we can kind of help people throughout the year periodically, which is good to help grow the pool, which we know will help us be successful. And also it just helps people, meet them where they're at. So we can we're casting a wider net. We're more adversely selective. How do you receive a quote? It takes a couple days, but we've already kind of touched on it, right? We're going to call you and we're going to send you what we need. Your goal, we're going to hand you the baton. Once you get that information back over to us, we're taking the second leg of the race. We're going to go out and get those proposals and put them together and help you review them and compare them. Really what I imagine and what we're seeing so far is we have someone that'll say, hey, I just want something super similar to what I got right now. So I know that we need a robust network. I know that we need a major carrier. I'm going out and I'm finding, one or two options that are very similar. Or I have somebody that's like, listen, I want you to drop the rates out of the floor. I want to pay as little as possible for this. And then we get a little bit more extreme and we get a little bit more out of the box. If you can give me some guidance and direction on what you want for your pharmacy, or some people say we want to see the whole thing, right? The whole spectrum, that's fine. But we are going to be doing this for a lot of groups. So timeliness is very important, and it also helps us stay organized. I've already kind of gone over the information that's required. If you go to the microsite, it talks about having a census. Let's see here. There's a census for 10 or more or fewer than 10 employees. And this is not to make it more complicated than it is. It's really simple. If you have more than 10 enrolled employees, all you need to send us is a census. Very simple. If you have less than 10, then we do have to have actual underwriting health questionnaires. I don't like the website because it says applications. You're not applying for insurance. You're not signing up to pay for anything. It's merely an online screening process. But we have to do that in order to generate rates. So there's all kinds of instructions, right? There's a questionnaire. You can complete it on the desktop. It literally will walk you through. Cody has put a scribe together, what website to go to, what buttons to click. This will help your employees complete those questionnaires. There's no excuse that it should take them more than a week. That's what we ask for. So if you have less than 10 and you're going to go through this process to get new rates, we ask that you do this in less than a week. Otherwise, they're all time stamped and you'll have to start over. And that just is going to make you angry and upset. And we're not trying to do that. What's the transition process looks like? Well, we're going to meet you where you meet us. So if you can get us the information on time and we get a plan picked very quickly, we're going to help you set up your employer portal. We're going to help you conduct open enrollment. A lot of times, again, it's for small enough groups where we just put a premium page together and we're having employees fill that out, and then we submit a census, an enrollment census, and that's what dictates the carriers and to who to enroll and where to send ID cards, right? It's going to have addresses and dependents and things like that. We really are an extension of your team. So customer service is really, really important. You're not going to call a 1-800 number. You're not going to call a resource center. You're calling physically me, Scott, Jordan, Mariah, all the people at our office. Like, we have an office here in mid-Missouri, 573-893-2110. Scott, is that right? Did I get that right? 2110. If you call that number, you're going to talk to someone in receptionist, right? Whether it's Deborah or Jordan or Mike or Eric, it's literally us. So we can help you get through some of those challenges. Okay, how does underwriting work? That's going to be different for each carrier. Okay, so once you get us the information, they're going to have their own manual to do that. And then we will help communicate changes to you and your staff members. So if the plans are changing, it's really important to get ahead of that before open enrollment. We'll help you put together some collateral that that can, at least make sure that they know that there are potential changes coming around the corner. What I've seen most of the time, you guys are very cohesive with your employees as independent pharmacy owners. That's definitely very true. They respect you all, they hear you all. So when you're suggesting changes, they're open to that, and we can sort of help manicure that message. Or, if the changes aren't positive, if you're really gutting out your plan to save money, you can blame us. We don't mind being bad guys. We'll do that. Compliance. This is everybody's most important topic. I still haven't seen any questions come in the chat, Rita. I'm trying to actively monitor it, but
I think you're just doing such a great job of covering everything.
Yeah, I'll pay you later. I'm sure that's not the case. We're gonna have emails that come in after the fact.
Okay, take Venmo.
Yeah, right. Compliance is the least attractive leg in the entire benefit space. To me, it's absolutely disgusting. So we've got partners that help us do that, whether they're inside the carriers, right? So if the carriers are going to help them themselves, or we partner with a company called Task, and we white label them. They do that for us. I do not want an E&O claim. I don't want you to have liability. I want the Department of Labor calling you. Yes, chat is working. Okay, cool. We want to make sure that this box is checked and that it's locked and keyed and, done and over with. The easiest way for us to do that is to bring someone in who knows what they're doing. Insurance companies 95% of the time are going to take care of this. They're going to handle the reporting and the summaries of benefits and coverage and the important notices. Those are all different by state, right? They're different based on how small or large you are. So we have some help with that. You can always call us, though. We want to be the first line of defense. If I have 5 employees, all 5 have to sign up for 1 or 2 different plans. No, not necessarily. So some carriers will only require maybe 2 people to be enrolled to offer 2 plans. The more people, general rule of thumb, the more people you have enrolled, then the more plans that you can offer. If you have 5 employees, I would not recommend offering 3 or more unless you have a very unique situation. And again, at the end of the day, it depends on the carrier. So let's say, for example, you go to the Triad plan, which is for our pharmacists. Maybe they'll offer you 3 plan designs across 5 people if you have that many enrolled. If you have only 2 people, then they're going to want to see either 1 or 2 plan designs. Hopefully that answers your question. Some of us can't use words this early in the morning. I feel you. That's why you've seen me down this entire cup of transparent coffee. And you guys are going to get my contact information at the end of this. So if this is frustrating and all kind of a blur, just call me. I've got my cell phone listed. You can email me. We're people. We answer the phone. We'll help out. Billing and claims issues, that's us. Reach out to us first. And if we can't solve your problem, we'll get in touch with the carrier. We want you guys working the bench, helping your patients, helping your employees. How does COBRA work? So if you're in a state that requires mini COBRA, if you're in a carrier enrolled plan that requires COBRA, they're gonna, and again, it's so different. The Triad plan does not require that you offer COBRA. So if someone leaves, you don't have to extend their benefits unless you are in a state that requires mini COBRA. That's why we stay out of the state of Washington. I'm apologizing in advance if you're on the call and you live in the state of Washington, and I feel really bad for you because it's super early in the morning over there. If you need COBRA, we'll help you get it taken care of. Okay, that's at the end of the day, that's what we're going to do. And I've already talked about Task, right? So SPDs, notices, reporting. And again, a lot of times the carrier is going to check that box for you, especially in the small group space. Okay, get your phones out, snap a picture of this or punch my contact number. This is literally my personal cell phone number. If you called me right now, my phone would ring. Travis, all of our emails are on there. The way this works when you fill out that form, and again, this is the most important step, is to come to the microsite. Homepage looks like this, and just click get a quote. This link is in the most recent newsletter. I don't know, Rita, is it hosted on your all's website too? I can't remember.
I'll check on that for you.
Okay, I'm just curious. And if not, Cody can definitely do that. So yeah, you'll click get a quote, and then you come through and you fill this stuff out. And then we are going to call you, maybe to the tune of a little bit of annoying, just to make sure that we stay on you and that you guys get this done. And if you're not going to do it, we also just want to know so we can cross your name off the list. Like we gave a certain level of commitment to American Pharmacies because they do, let's see, need contact info put back up. You got it. They want to make sure that you guys are all taken care of. And Scott just dropped the website in the chat too. So you can click that URL right now, hopefully, and that'll take you right to where you need to go. But yeah, we want to get in touch, even if you're not going to do something with us or with American Pharmacies moving forward. We at least want to be able to report back to Rita and her team and say, hey, we talked to them, but they're going a different direction, or maybe they're not offering benefits. Whatever your story is, it's our goal that if we have 44 insured MIWA members, we need to know where they're all going. That way we don't miss anybody. So,
got a hand up, Reese?
What's that?
We got a
Yeah,
hand up.
yeah.
What do you got? I didn't see the hand, Scotty.
Rick Westman? Westman? Got a hand up? Rick, you got a question? You might just unmute yourself.
We also have another question in the chat about who to make the monthly payments to, how billing would work.
Yep. Okay, so that's going to be really, it's going to be individual group billing regardless of what you do, because we're not technically marrying all of you and putting you in one solution. So for example, if you're joining the Triad plan, you're going to have an ACH draft set up with Triad that's based on your monthly enrollment. You'll have a portal to be able to log in and update that. So you're going to make payments to the actual insurance company or the solution that you're doing. If you're on an individual plan, you may hook up a debit or a credit card and pay that individual plan, right? Like CHOS or LifeX or Datego, one of those. If you're on an ICHRA plan and you're working with Zorro, or if you're working with Task for the ICHRA component, you're going to pay your premiums to that company. So we're no longer sending money to, right? Because Rita, they paid American Pharmacies previously.
That's
and
correct.
You guys were sort of a consolidated billing organization. This is a little bit more custom in that it's a solution just for your pharmacy. So you're going to be paying whoever or whichever carrier or company brings their best foot forward. Insurance company directly. Yep. Our job is to find the right company for you. Yes, we're brokering and dealing directly with the insurance company. Hey, if you want to deal with the insurance company, be my guest, but that's what we're here for. We're good at beating them up, which is our job.
Yep.
That's essentially what we do. All right, I got that one answered. Rick, you still do have a hand up. I don't know if I can unmute you or not. It won't let me. But if you're welcome to type your question in the chat too. And Rita, or it looks like Rita put our contact information in the chat. So grab my cell. This is our office number down here, 573-893-2110. Travis's cell phone, my cell phone. If we don't get back to you, as you can imagine, we're having a lot of conversations this time of year, but if we don't get back to you right away, we're going to get back to you the same day. That's kind of our standard, our golden rule at Invictus. We're not going to let anybody go a full day without getting contacted back.
Well, that is all of our time, and I just want to thank everyone for being here this morning. I know it's very early for some of you. The webinar was recorded, and I'll send a recording to everybody, and I'll also send a copy of the presentation. And you're welcome to contact me if you have any questions as well. I hope everyone has a great day. Thank you.